I'm Helena Zweifel. I'm the coordinator of AIDS Focus, the Swiss platform on HIV/AIDS and international cooperation. And I'm also the executive director of Medicus Mundi Switzerland, the network Health for All. So I was in charge of organizing this conference on HIV, AIDS and advocacy. And our main issues, or our main objective is that advocacy is a key to bring about change in the lives of people. In our work as an AIDS-focused platform, we are working towards the right to health for all, and this means having the right, every person, be it man, woman, living in the south, in the north, wherever, has the right to best possible health care. That means for people living with HIV and AIDS, having access to treatment, care and support, or also people affected by it, like so many people are, especially in Southern Africa, or also India, we learned today, that all people affected by HIV/AIDS have a right to health. And for this advocacy, it means it's a process of bringing about change. And today's conference is a little step in such a process to bring about change. And it is so important to listen what people living in the South, being really affected directly in their day-to-day life by HIV, what they have to say and what they do of bringing about change. And we learned so much today, and I'm so happy, especially also on the statements of people working at grassroots, that the people themselves are empowered, are fighting for their rights, their entitlement to rights. They are addressing the governments, they are addressing institutions to get what is theirs, they are entitled to. And I think that's an important message we got from our partners in the South. Yes, we stand up for our rights. And I think as AIDS-focused platform, one thing is giving this platform to learn and take it further. It's also the members who work with development partners in the South, support initiatives like that. It's not just with the attitude which is common in the rest of Switzerland, not here. Like, oh, these poor fellows, they need our help. It's not like this. If they have the chance to stand up, to work towards their own rights, I think giving support, a little support in it, I think that's the best kind of development cooperation in advocacy. On the other hand, also being based in Switzerland, we also have some responsibility to bring about change within the Swiss government, within the Swiss policy. Like AIDS Focus is fighting together with all his members and also with the network Medicus Mundi Switzerland, that the Switzerland gives health a more prominent role, that Switzerland will invest more for health for all, for everything, and that includes for us also invest more into providing or making it possible that every person has access to HIV prevention, treatment, care and support. And that's our task. And we are discussing now which are the specific issues we should focus on. And I think one of it will be, or is, the Global Fund, who, even if they are, in the moment, they go through some difficulties, but this is the one organization which really implements, gives people a chance to live, provides worldwide provides medication, but also is strengthening health systems, also is helping to prevent mother-to-child transmission, so in future no baby will be born with HIV, so that's one of our real concerns. And so we see now linking up with our partners in the South, trying to influence on these issues the Swiss delegate in the board of the Global Fund. That's one of the topics we take up, and talking to people, trying to get the media interested on the issues, by the public interested on the issues, so that we find more support and agreement that, yes, it's everybody's right to have the best possible health.
Hello, I'm Dr. Kate Molesworth. I'm Health and Social Development Advisor at the Swiss Tropical and Public Health Institute. And today I'm here in Bern as I'm a member of the steering committee of AIDS Focus. And today we have our 2012 conference, which is entitled HIV, AIDS and Advocacy, bringing about change in policies and practice. In terms of HIV and AIDS, advocacy, on which we're focusing today, is important at two particular levels. And it's important that these two levels are involved to shape and evolve both the policy and practice in response to the HIV epidemic. These is the more upstream level: government, international organisations and experts, specialists. So these bodies and individuals are important to develop and process policy, and this will guide approaches and determine practice in response to HIV and AIDS. Advocacy is particularly important in engaging and having the voice of civil society heard. And this is particularly important, especially the voices of people living with HIV and those who are also affected by AIDS. These could be orphans or family members of people who have HIV and are suffering from AIDS. Their meaningful inputs are key to ensuring that the responses and the policy that determines those responses are effective and based on the dynamic realities at the grassroots level. This is important both to ensure that the response to the epidemic is realistic, but also fits the context both of the region, the village, and the social contexts. It's important to engage civil society, particularly people who are living with HIV and also those affected by AIDS, to bring about a meaningful input to policy and practice in response to the epidemic. This ensures that the policy that we develop and the practices we engage in are linked very strongly to the context of the epidemic, in terms of the regional context, the socio-cultural context, and the economic context. Advocacy to include people and people living with and affected by HIV into the process of determining policy and practice is important both from a public health point of view, from an effective response, but also from the point of view of realising human rights.